This is Dr. Stacy Fenning, and I'm going to be addressing the evidence-based practice inquiry in this video. The practice question. In creating the searchable, answerable practice question, we really want to look for the right information at the right time. The format that we use is called PIC-OT. This is one of many formats, but in this video presentation we will address the PIC-OT, which looks at population, intervention, comparison, outcome, and time factor that relates to the practice question. The P is for population. The population is the patient or client or the disease of focus. Examples include children ages 2 or older with uncomplicated acute otitis media. Another example would be staff registered nurses on medical floor or nurses in the emergency room. And as you can see, these are all populations. The I is for intervention. This is the new or different intervention or protocol or practice that is being considered. Here are some examples: watchful waiting with parental education, unit team building intervention, or professional journal club. The C of the practice question is the comparison. This is the current practice treatment. Or this could be absence of intervention. If, for example, there's something that is not being done on your unit, but you're considering implementing. Here are some examples. Standard treatment, which is immediate antibiotic prescription. The next example is current satisfaction survey. And the next example is current utilization, attitude, or knowledge of evidence-based practice. The O in the PIC-OT is for outcome. This is the expected impact or effects of a new practice on a population. Some examples of an outcome would be safe, cost-effective resolution with minimal side effects. Another example would be improved unit cohesiveness, nurse satisfaction, and less turnover rates. Another example would be improved utilization, attitude, or knowledge of evidence-based practice. The T is the time factor involved in your practice question, the time it takes for the intervention to achieve the expected outcomes. Here are some examples of the time factor: 72 hours, 6 months, 9 weeks of journal club, or you could say 4 journal club meetings. Bringing it all together. This is an example of bringing a practice question all together. In children ages 2 and over with uncomplicated acute otitis media, what is the effect of watchful waiting for 72 hours with parental education compared to standard antibiotic treatment on the course of illness? The next practice question in the PIC-OT format is: would 6 months of team building interventions among staff registered nurses on medical units impact the group cohesiveness, the nurse satisfaction, and turnover rates? And the final example of the PIC-OT, or your practice question in action, is: what are nurses' self-report of the utilization, attitude, and knowledge of evidence-based practice before and after 9 weeks of professional journal club participation? This is the reference slide for the evidence used for the PIC-OT question, and at the end of this presentation will be my contact information if you have any questions.